What if I told you that the answer to stronger blood flow, a healthier prostate, and more energy in the bedroom is not in a pill bottle, not in a prescription pad, and not in an expensive supplement, but sitting right inside your kitchen, right now, this very morning? Stay with me. Now let's get into it. I am Dr. Akira Tanaka, a urologist with over 30 years of experience helping men like you regain their energy, performance, and vitality. And in nearly 3 decades of sitting across from men in their 60s, 70s, and 80s, I have heard the same words more times than I can count. Doc, I just do not feel like myself anymore. Not sick, not broken, just fading. And what breaks my heart every single time is this. Most of those men were not suffering from something that required surgery or a lifetime of medication. They were suffering from something far simpler. They were not giving their bodies the right fuel, specifically in the morning, specifically at the moment when their body is most open to receiving it. Today, I am going to share with you the 8 most powerful foods that men over 60 can eat every morning to dramatically improve blood flow, protect and support prostate health, and restore the kind of vitality that most men assume is simply gone with age. These are not exotic superfoods from a health magazine. These are real, affordable, accessible foods backed by science and proven in my own clinical practice. And near the end, I will share a specific morning combination that my patients have used to feel noticeably different within just a few weeks. So stay with me all the way through, because what I am about to share could genuinely change how you feel every single day. If you're new here, welcome to the channel. Before we go any further, if you're serious about protecting your prostate, staying strong, and living without fear, hit that subscribe button and turn on notifications. I share real information backed by real science for men just like you. And if this topic matters to you, type 1 in the comments and tell me where in the world you're watching from. If not, type 0 so I know how to help you better next time. The morning food that directly feeds your blood vessels. Let me start with something most men over 60 have never been told, and it is this. Your blood vessels are living tissue. They are not pipes, they are not fixed structures, they are dynamic, responsive, and deeply affected by what you eat, especially in the first hour after waking up. When you sleep, your body goes into a repair and restore state. Your circulation slows, your blood pressure naturally drops. And when you wake up, your cardiovascular system is essentially restarting for the day. What you eat in that first hour either supports that restart or works against it. I had a patient named Victor, 67 years old, retired marine biologist, a man who spent his career studying living systems and thought he understood his own biology well. He came to me because his erections had become weak and inconsistent, his energy crashed by mid-morning, and he had started waking up twice a night to urinate. He was frustrated because nothing obvious was wrong. His heart was fine, his testosterone was low, normal, and yet his body felt like it was running on empty. When I asked him what he ate in the morning, he said, usually nothing until about 10. Sometimes a piece of toast. And there was the problem. Victor's blood vessels were going hours every morning without the nutritional support they needed to dilate properly, circulate efficiently, and deliver oxygen and hormones to the tissues that needed them most, including his prostate and the vascular tissue responsible for sexual function. The first food I put him on was beetroot. Specifically, half a small beet or a small glass of beet juice, consumed within 30 minutes of waking. Here is why this matters. Beetroot is one of the richest natural sources of dietary nitrates on the planet. Your body converts those nitrates into nitric oxide, the same molecule that pharmaceutical companies spend billions trying to mimic in erectile dysfunction medications. Nitric oxide tells the smooth muscle inside your blood vessel walls to relax and open up. When those vessels dilate, blood flows more freely, more quickly, and in greater volume to every part of your body, including the arteries that serve both your penis and your prostate. Victor was skeptical. He said, "Doctor, a beet? What is your recommendation?" I smiled and said, "Give it 3 weeks." 4 weeks later, he came back and sat down slowly, the way men do when they are trying not to smile too wide. He said, "I do not know what is happening, but I feel like my circulation has been turned back on." His nighttime bathroom trips had reduced, his energy was more consistent, and yes, his erections had noticeably improved. One food, one small, simple, inexpensive food eaten in the morning. That is where we begin. And if you think that is impressive, what I am about to share next surprised even me the first time I saw the research. The breakfast staple that protects your prostate every single morning. Most men think of prostate health as something they manage with medications or supplements. Very few think about it at the breakfast table. But the truth is, what you eat in the morning has a direct and measurable effect on prostate inflammation, urinary function, and the hormonal environment that determines how well your prostate behaves throughout the day. The food I am talking about is pumpkin seeds. And before you dismiss them as bird food, let me tell you about Marcus. Marcus was 72 years old, a retired school principal, sharp, disciplined, a man who ran his household the same way he ran his school, organized, precise. But he had been waking up 3 and 4 times every night to urinate. His stream was weak, and he had started avoiding long car trips because he could not trust his bladder. His prostate was enlarged, his urologist had discussed medication, and he was not happy about it. When I asked about his diet, particularly his morning routine, the picture became clear immediately. His breakfast was coffee and a pastry, every single morning, for years. High in sugar, zero nutritional support for his prostate, and the caffeine was actively irritating his bladder and contributing to his nighttime waking. I made one addition first, a small handful of raw pumpkin seeds with his breakfast every morning. Pumpkin seeds are extraordinarily rich in zinc, a mineral that concentrates naturally in the prostate gland and is essential for its healthy function. Studies consistently show that men with enlarged prostates tend to have significantly lower zinc levels than men with healthy ones. Pumpkin seeds are also rich in phytosterols, plant-based compounds that directly inhibit the conversion of testosterone into a more potent form called DHT, which is one of the primary drivers of prostate enlargement. Within 6 weeks, Marcus reported his nighttime trips had dropped from 3 or 4 down to 1. His stream was stronger. He felt less urgency throughout the day, and his mood had lifted because he was finally sleeping through the night. He told me, "Doctor, I wish someone had told me about this 20 years ago. That is what I hear more than anything else." Not surprised at the result, surprised that something so simple was never mentioned before. And that brings me to the next food, one that most men eat completely wrong, at the wrong time, in the wrong form, and are missing almost all of its benefits as a result. The common fruit that becomes a blood flow powerhouse before noon. I want to talk about watermelon, and I need you to forget everything you think you know about it, because most men treat watermelon as a summer snack, something sweet and refreshing with no real nutritional significance. That is a mistake. Watermelon is one of the richest natural sources of an amino acid called L-citrulline. Your body converts L-citrulline into L-arginine, and L-arginine is the direct precursor to nitric oxide, the same molecule we discussed with beetroot. What this means is that watermelon is essentially a natural, gentle, food-based vasodilator. It opens your blood vessels from the inside using your own biochemistry, with no side effects, no interactions, and no prescription required. I had a patient named Dennis, 64 years old, recently retired from 30 years in construction, built like a man who had worked hard his entire life. He came to me because his blood pressure was creeping up, his erections were unreliable, and he had noticed that even walking up a flight of stairs left him more winded than it used to. He was not obese, he did not smoke, he had no major cardiac history, his circulation was simply beginning to decline with age. I asked Dennis to add 2 cups of fresh watermelon to his morning routine, eaten within the first hour of waking, on an empty or near-empty stomach for maximum absorption. I also told him to eat the white rind wherever possible, because the rind contains even higher concentrations of L-citrulline than the red flesh. He looked at me like I had lost my mind. He said, "You want me to eat the rind?" I said, "I want you to feel better." He agreed to try. 6 weeks later, his blood pressure had dropped measurably. He reported feeling warmer in his hands and feet, a sign that peripheral circulation was improving, and he told me quietly that things in the bedroom had shifted noticeably. Not dramatically, not overnight, but real and undeniable. That is what food-based nitric oxide support does when it is consistent and timed correctly. It works with your body's own morning restart to open the vessels that have narrowed with age. But here is something that will surprise you. The next food on this list does not look like a health food at all. In fact, most people think of it as an indulgence, but the science behind it is extraordinary. The morning drink that most men are having the wrong way. Before I reveal the next food, if you are still watching and finding real value in what I am sharing today, I want to take just one moment to ask you something. Please hit the subscribe button right now. I publish new content every single week specifically for men over 60 who want real, science-backed answers about their health, their vitality, and their longevity. No gimmicks, no empty promises, just the truth that your body deserves. Hit subscribe and turn on the bell so you never miss it. Because what I am about to share next is something almost no doctor brings up in the exam room, and it may be the most surprising thing you hear today. The food is dark chocolate. Specifically, a small square or two of dark chocolate containing at least 70% cacao consumed in the morning rather than as an evening dessert. I know what you are thinking. I had the same reaction when I first reviewed the research, but the evidence is genuinely compelling. Dark chocolate at high cacao percentages is rich in flavonols, a class of plant compounds that stimulate the inner lining of your blood vessels, called the endothelium, to produce nitric oxide. The same molecule, the same mechanism, the same result. Better blood flow, more responsive vessels, and improved circulation to every tissue in your body, including your prostate and your pelvic region. The key is timing and quantity. A small amount in the morning, when your body is in its peak metabolic window and most responsive to dietary input, delivers far more benefit than the same amount eaten at night when digestion is slower and circulation is winding down for sleep. I had a patient named Harold, 69 years old, a retired jazz musician with a sharp mind and a dry sense of humor. He came to me low on energy, frustrated with his declining sexual function, and deeply skeptical of anything that sounded like health advice. He said, "Doctor, I have heard it all. I am not interested in kale smoothies and cold showers." I said, "Harold, I am prescribing you dark chocolate." He went quiet for a moment and then said, "Now you have my attention." He added 2 small squares of 85% dark chocolate to his morning routine alongside his breakfast. Within a month, he reported feeling more mentally alert, more energized through the morning, and noticeably warmer circulation in his lower body, which he described with a laugh as things waking back up down there. That is the power of food timed correctly. And the next food connects everything we have discussed so far into a single, ancient, extraordinarily powerful morning habit. The ancient spice that fights prostate inflammation. While you eat breakfast, inflammation is the silent enemy of every man over 60. It sits beneath the surface of most of the conditions that diminish quality of life in older men, including prostate enlargement, poor circulation, erectile dysfunction, joint stiffness, and low energy. And while inflammation has many causes, diet is one of the most powerful levers available to fight it. The spice I am talking about is turmeric. Specifically, half a teaspoon of turmeric powder consumed in the morning, ideally mixed into warm water, a smoothie, or eggs, alongside a small amount of black pepper, which increases absorption by up to 2,000%. Turmeric contains an active compound called curcumin, one of the most studied natural anti-inflammatory agents in medical literature. Curcumin directly inhibits the inflammatory pathways that drive prostate enlargement, reduce vascular flexibility, and impair sexual function. It also supports healthy testosterone metabolism by reducing the activity of enzymes that convert testosterone into estrogen, which becomes increasingly important for hormonal balance in men after 60. I want to tell you about a patient named Yusuf, 71 years old, a retired professor of mathematics, precise and methodical in everything he did. He had been dealing with chronic prostate inflammation for years, had tried multiple medications with limited results, and came to me looking for anything that might help without adding another prescription to his list. We built an anti-inflammatory morning protocol around his existing breakfast. Turmeric with black pepper in warm water first thing in the morning, before anything else, alongside the beetroot, the pumpkin seeds, and the dark chocolate we discussed. Within 8 weeks, his prostate inflammation markers had dropped significantly on his lab work. His urinary symptoms improved. He was sleeping through the night for the first time in 2 years, and he told me with great satisfaction, "The math on this is remarkably simple, doctor. Less inflammation, better function. I could not have said it better myself." And what I am going to share next ties everything together, because there is one more morning habit that acts like a master switch for everything we have discussed so far. The breakfast protein. that rebuilds the foundation of male vitality. I see a pattern in men over 60 that concerns me deeply, and it is this. Most of them are not eating enough protein in the morning. They have coffee, maybe some toast, perhaps a small bowl of cereal, and then wonder why their energy collapses by mid-morning. Their muscles feel weaker than they used to, and their hormones feel completely out of balance. Here is the physiological reality. Testosterone, the hormone most central to male vitality, sexual function, muscle maintenance, and mood, is built from cholesterol and amino acids. Amino acids come from protein. If you are not consuming adequate, high-quality protein in the morning, your body quite literally does not have the raw materials it needs to maintain healthy testosterone levels. The specific morning protein I recommend to my patients over 60 is eggs, specifically 2 to 3 whole eggs, not just egg whites, consumed as part of breakfast. The yolk contains the cholesterol your body uses as the direct building block for testosterone synthesis. It also contains choline, essential for nerve signal transmission, which plays a direct role in the neurological component of sexual arousal and erectile function. I had a patient named Bernard, 66 years old, retired airline pilot, a man who had spent decades following strict health guidelines that told him to avoid egg yolks because of cholesterol concerns. He had been eating egg whites only for 20 years. His testosterone was low, his energy was poor, his erections were weak, and he was deeply confused because he felt like he had done everything right. We restored whole eggs to his morning routine and explained the updated science on dietary cholesterol, which has been significantly revised over the past decade. Within 6 weeks, his energy had measurably improved. His testosterone had risen to the high end of his normal range, and he came back into my office looking lighter, more present, more like the man he described being in his 40s. He said, "I cannot believe I avoided the yolk for 20 years. Doctor, I feel like I gave up something essential and just got it back." That sentence stayed with me, because that is exactly what happened. And now, everything we have covered today comes together in the final morning protocol that my patients use to feel noticeably different within weeks. The morning foods. Most men over 60 are missing entirely. Let me quickly recap what we have covered because I want it to land fully before we move into the complete morning routine. Beetroot feeds your blood vessels with the nitrates they need to produce nitric oxide and dilate properly. Pumpkin seeds protect and support your prostate with zinc and phytosterols. Watermelon and its rind flood your system with L-citrulline, the natural precursor to better blood flow. Dark chocolate at 70% cacao or higher stimulates your endothelium and opens your vascular system using flavanols. Turmeric with black pepper fights the chronic inflammation that silently attacks prostate health and circulation. Whole eggs give your body the cholesterol and choline it needs to build testosterone and support nerve function. But there are 2 more foods most men over 60 are missing entirely, and they are arguably the simplest of everything on this list. The first is pomegranate. Pomegranate juice or seeds consumed in the morning have been shown in clinical research to reduce PSA levels in men with prostate concerns, improve erectile function scores, and increase antioxidant activity in the blood. One study found that men who drank a small glass of pomegranate juice daily saw measurable improvement in erectile function within 4 weeks. The mechanism is the same. Antioxidants protect nitric oxide from being broken down before it can do its job, meaning more nitric oxide stays active in your blood vessels for longer. The second is oats. Specifically, whole rolled oats eaten in the morning. Oats contain a compound called avenanthramide, a unique antioxidant found almost nowhere else in the food supply that directly reduces inflammation in blood vessel walls. They are also a gentle, sustained source of complex carbohydrates that keep your blood sugar stable through the morning, which is critical for maintaining healthy testosterone levels. Blood sugar spikes and crashes directly suppress testosterone and elevate cortisol, the same hormonal seesaw we discussed in the context of dehydration. I had a patient named Clarence, 73 years old, retired pharmacist, a man who knew more about medication than most of my colleagues. He came to me because he was embarrassed. He said, "Doctor, I know what my body needs. I just have not been giving it to me." His prostate was enlarged, his circulation was poor, and his energy was almost completely depleted. We built him the full morning protocol. Warm lemon water first, then whole oats with a tablespoon of pumpkin seeds and a small handful of pomegranate seeds mixed in. alongside a small glass of beet juice and 2 whole eggs cooked simply, 2 squares of dark chocolate with his coffee, and half a teaspoon of turmeric in warm water taken before eating. 6 weeks later, Clarence brought me his own notes. He is a pharmacist. Of course he kept notes. His urinary symptoms had improved significantly. His energy was consistent through the morning for the first time in years. His nighttime bathroom trips had dropped from 4 to 1. And he said something I found deeply moving. He said, "Doctor, I spent 30 years helping other people manage their symptoms. I did not know I could actually improve mine. That is the difference between managing and restoring. And that is exactly what food, timed correctly and chosen deliberately, can do for a man over 60. Your complete morning protocol for blood flow, prostate health, and vitality. Everything comes together here. This is the complete morning routine I give my patients, built specifically for men over 60 who want to support circulation, prostate health, and sexual vitality through food. The moment you wake up, before anything else, drink 1 glass of warm water with a squeeze of lemon. This gently activates your digestive system, supports your liver, and prepares your gut to absorb everything that follows. Within the first 30 minutes, have a small glass of beet juice or eat half a small cooked beet. This is your nitric oxide primer. It begins opening your blood vessels before the rest of your morning even begins. For breakfast, eat 2 to 3 whole eggs cooked simply, scrambled or poached, alongside a bowl of whole rolled oats, topped with a tablespoon of raw pumpkin seeds and a small handful of pomegranate seeds. This combination gives your body testosterone building blocks, prostate protective zinc, anti-inflammatory phytosterols, and vascular protective antioxidants, all in one bowl. Add 2 cups of fresh watermelon on the side, including a little of the white rind if you are willing. This is your L-citrulline source, your natural blood flow amplifier. Take half a teaspoon of turmeric mixed with a pinch of black pepper in warm water, either before or alongside breakfast. This is your anti-inflammatory anchor that protects your prostate and your blood vessels from the inside. And allow yourself 2 small squares of dark chocolate at 70% cacao or higher, alongside your morning coffee or tea. This is not an indulgence. This is medicine, taken in the morning when your body is most receptive to its benefits. That is the complete protocol. It takes no more time than most men already spend on breakfast. It costs less than most supplements. And it works because it gives your body exactly what it is asking for, in the exact window when it is most able to use it. Your body is still listening. I want to leave you with something important, and I want you to hear it clearly. You now know that beetroot produces nitric oxide and opens your blood vessels from the very first morning bite. You know that pumpkin seeds deliver zinc directly to your prostate and block the hormonal pathway that drives enlargement. You know that watermelon rind contains the natural amino acids your body uses to improve blood flow without a prescription. You know that dark chocolate at high cacao percentage stimulates your endothelium in the same way clinical medications do, but gently and naturally. You know that turmeric with black pepper fights the chronic inflammation, silently attacking your prostate and circulation every single day. You know that whole eggs give your body the raw materials for testosterone production that egg whites simply cannot. You know that pomegranate protects your nitric oxide from breaking down, keeping your circulation strong and responsive. And you know that oats stabilize your blood sugar and protect your blood vessel walls with compounds found almost nowhere else in the food supply. None of this is complicated. None of it is expensive. None of it requires a prescription or a specialist or a procedure. It requires only that you make a decision, starting tomorrow morning, to give your body what it has been quietly asking you for. I have spent nearly 3 decades watching men walk out of my office with more energy, more confidence, and more hope than they walked in with. Not because I gave them something complex, because I gave them something true. A simple, consistent, food-based morning routine that reminds the body of what it is still capable of doing. You are not too old. Your body has not stopped listening. It is simply waiting for the right signal. Start tomorrow morning. 1 glass of warm water with lemon. 1 small glass of beet juice, 2 whole eggs, a bowl of oats with pumpkin seeds and pomegranate, some watermelon on the side, 2 squares of dark chocolate, half a teaspoon of turmeric with black pepper. That is your signal. Send it every morning, and watch what your body does in return. Stay strong, stay nourished, and I will see you in the next video.